Okay, so hello everyone. My name is John Michael Cabusas Bando, one of your reporters for this topic. So for this time around, we will be discussing the people in conflict affected communities. Together with me is Miss Eve Christine Joy Ohel. So without further ado, let us start. So these will be the contents of our report. First, we have the introduction. Second, we have the demographics and epidemiology. The next one, we have the issues together with its programs and services. And lastly, we have the insights and recommendations. So, what is conflict-affected communities? So, commonly you know, ang madug na to when it comes to conflict-affected communities, we define it as areas where terrorism exists na yung mga gira-gira na hitabo. So, tama mo siya actually. But according to the definition, conflict-affected communities are identified by the presence of armed conflict, widespread violence, or other risk of harm to people. So, conflict-affected communities, dili lang limited diri ang mga tourism acts or mga gira-gira. Dili po nahitabo, dili po na-exist ang mga widespread violence or other risk of harm to people. Example daan yung mga kanang political clashes or clan clashes. According to a data, the Philippines are one of the country that experience armed conflict for so many years. Moreover, conflict may harm social relations leading to, so these are the effects of conflicts in these communities. It decreases social cohesion and weakens social capital. It reduce resilience. Also, this may lead to psychological, sociological, and economic effects within a society due to a social disintegration. So moving on. Okay, so according to UN in 2022, there is 2 billion people, or a quarter of the world's population, now lives in conflict-affected areas. So, dako-dako unjud no ang mga affected people around conflict-affected areas. So in 2021, there are 19,000 children with either recruited as child soldiers, killed or maimed, subjected to sexual violence, or abducted in armed conflicts. Moreover, there is an estimated 84 million people who were forcibly displaced because of conflict violence. So when we say displaced, this is where people from a certain community or from a certain country moves to another place para lang jud ma-avoid ang mga gira-gira o mga conflict sa ilahang lugar, who seeks for peace. Ganun. So, it is estimated that 274 million people needs a humanitarian assistance due to conflict. Moving on. Okay, so according to Global Terrorism Database in 2020, there is an estimated 22,847 people died due to terrorism globally. Over the previous decade, the average number or the yearly number of deaths was 26,000. However, there can be significant year-to-year variability. Over this decade, the global death toll ranged from its lowest of 8,200 in 2011 to the highest with 44,600 deaths in 2014. So let's go to local. Next, we have the Philippines Tourism Index. So this data represents us the terrorism acts happened in the Philippines from 2014 to 2022. So we have the highest rate in 2018 where there was 7.174 tourism acts. And according to the Tourism Index of the Philippines, there is a decrease to 6.79 in 2021 from 7.07 in 2020. So it is a good news for us. Moreover, in 2017, the World Bank showed 620 deaths due to armed conflicts in the Philippines. So kanina presentation, so morning mga data sa mga death toll due to tourism in the Philippines. In 2017, we have recorded 1,620 deaths. So, in 2017, di rin hitabo itong Marawi siege. So, nakakontribute siya sa death toll of tourism sa atong sa Philippines. So, it led to 1,620 deaths. So, these are the drivers of conflicts in the Philippines. So, as what I have said earlier, di ilang mga tourism acts or mga gira-gira ang nahitabo dira sa conflict-affected areas. The main types of violence and conflict include the violence by state actors against civilians. There's also a clan-related violence, political and armed conflicts by nationalist or separatist groups in Mindanao and the Sulu Archipelago. There is a communist-inspired guerrilla campaign, violent extremist and criminal groups, anti-drug vigilantes, other criminal violence, domestic and gender-based violence, protest, violence around elections, and local conflicts over resources and community rights. So next one, we have the epidemiology. So there is about 22% of people who live in conflict areas suffer from mental health problems. A new study review finds. The common problems include depression, anxiety, post-traumatic stress disorder, bipolar disorder, or schizophrenia. This was according to World Health Organization data. Elevated levels of environment-related risks such as smoke bombs are among the major causes of serious illnesses, physically and mentally. It increases exposure to disease. This population may be vulnerable to infection and disease because of high levels of undernutrition or malnutrition. So the people in this community, they are vulnerable sila or dali rin sila kanang magka-infection dito due to high levels of undernutrition or malnutrition. Additional na po dira ang grabe ka polluted na environment tungo sa mga smoke bombs, mga destroy the mga establishments, and water and sanitation. Also, there is the low vaccine coverage or long-term stress. Okay, let's proceed to the issues. So, war adversely affect combatants and non-combatants or the civilians, both physically and mentally. The terror and horror spread by the violence of war disrupts lives and severes relationships in the families, leaving individuals and communities emotionally distressed. So one of the issues present in this suffered by the people around in the conflict affected communities is their mental health condition. So as you all know, mental health includes our emotional, psychological, and social well-being. It affects how we think, how we act, and how we feel. It also determines how we handle stress and relate to others, and also how to make healthy choices. So, mental health condition. According to World Health Organization data on 2019, there are more than 1 in 5 people in conflict-affected areas suffered or live with a mental health. The same study presented to us the recurrent or the most common disorders in conflict zones, which is the depression, anxiety, post-traumatic stress disorder, bipolar disorder, or schizophrenia. In many countries in the world, ignorance about mental health and mental illness remains widespread. So there are many countries na ginadeny nila ilang mental health condition sa mga tao or dili na ginagaan og bili. A report by the World Health Organization showed that there are only around 1,200 practicing psychiatrists, psychologists, and psychiatric nurses in the Philippines in 2020 for mental disorders. So next slide, we have the causes of mental disorders in conflict-affected areas. So these are only some of the causes of mental disorders in conflict-affected areas. First, we have the direct exposure to traumatic events. So this one, So in these events, these are events na nag-experience din mo personally or harap-harapan. Example ani is ang sexual harassment for women. Ang kaning sexual harassment for women is common siya mostly sa kanang mga terrorism ay mga conflict affected areas, especially pagka ng mga terrorism nga kanong mga nadakpan ng mga women, they are usually abused or sexually harassed by terrorists. So other traumatic events na directly na ma-experience sa mga tao sa conflict affected areas ay kanang mga bombings, direct exposure to bombings, direct exposure to killings, di ba? Maka-cause yun na siya mga traumatic events. The next one is we have the loss of loved ones. So loss of loved ones and the other causes presented is are some of the indirect effects sa mga mental disorders sa mga tao. So we have the loss of loved ones. Third, we have the loss of assets and lack of source of income. So normally pag na mga gira mahitabo, mga wadan nyo mga panginabuhi kay magubato mga establishments, mga factories atong mga pangkabuhayan like our fields, mga palayan and others. So next one, we have the adjustment to new environment. This fourth one is very common sa mga displaced person. Usual gini sila kay syempre pag displaced people ka, displaced person ka, you move from one place to another nya mabaguhan kasi mong environment, and with that you should adapt, but with that adaptation nagyap yung mga challenges na mahitabo. The next one, we have the immense responsibilities in the family. Lastly, we have the physical disability, especially sa mga kanong mga combatants or mga nisabak o gera na nakasurvive. Ito mga nangapungkol, nangabuta, nangabungol tungod sa kakusog sa bomba. Diba? So, these causes contributes to mental disorders due sa mga tao in conflict-affected communities. Moving on, so we will be tackling about sociological theories. So in structural functionalism, the functionalist perspective emphasizes that good health care, a good and effective medical care are essential for our society's ability to function. Ill health impairs our ability to perform our roles in society, and if too many people are unhealthy, society's functioning and stability will suffer. So as we all know naman, di ba, na when we say structural functionalism, it emphasizes the importance of every institutions in a community. So in this issue, we can see the importance of health and healthcare institutions. If they contribute less to people needing for mental health care, society's functioning will be unstable and most likely suffer. Okay, moving to our next theory, we have the conflict theory. In this theory, people battle for survivability. There is a race for resources due to scarcity of their needs. In this theory, the conflict that can be seen in the mental health field is the difficulty of getting mental health help, especially sa mga country na lack of mental health facilities, ganyan yung mga healthcare services. Sa Philippines, example, conflict theories would argue that those with the fewest resources are those that have the least amount of resources. They will be usually the ones who suffer from mental health illness. So, as you all know, dili ba dalim no na magutman or magsuffer ka sa imong environment sa conflict-affected areas. Mas stress man gani tag walay kwarta, how come na lang dito ang mga tao in conflict-affected areas who suffered more, grabe ka, tragic lang experience. And those who are closer to health needs sometimes are more prioritized. So there is inequality hapon dili ana setting kay example kanang mga elder, ang mga old persons, di ba dili na sila dali-dali maka-seek or maka-receive ng mga government services kay siyempre tigulang na nga kanang hina na sila moadto sa mga sources. And there are also na kanang mga those who are closer sa mga politicians or kanang mga dagkong tao, they are more likely to receive more services rather than katong mas mga nanginahanglan jud. So, di ba, there is still inequality happens in conflict-affected communities. So, moving on, we have our last theory, the symbolic interactionism. So, in this theory, beliefs and cultures of people really negatively contributes to their mental health conditioning, because most individuals that have a mental health disorder neglect health services because of their belief and culture instead of seeking help to the government services or healthcare services. They have this belief na ang mga ailments na ilang suffer is only a curse or a test by God or Allah or kinsa man ilang gipang tuuhan. And some of them are afraid to be seen as weak and isolate themselves. So this one is very common siya sa mga lalaki, no? We commonly see men as the dominant one or ang mga strong ones. So that is why they prefer to isolate themselves, na dili nila express ilang mga gibati jud, na di sila gusto malantaw sa people as weak. Nya matingala na lang ta na there are men na ay mostly instances na tingala ta nagtubok na dito as kuan, nagbitay na dito sa puno. So di ba, no, grabe siya na mga tradition or mga symbols gani which really negatively affects sa mga mental health conditions sa people around this area. So next one. Okay, so let's talk about SPECSIG analysis. So the first one, we have the social lens. So in social lens, we determine the relationship of the people are in conflict-affected areas. Socially speaking, people in these areas usually battle for resources instead of helping and giving for survivability. Though dili mo siya tanan actually, there are instances jud na in order for them to survive, there is inequality, there is biases na mahitabo. And other one, they prefer seeking help for close family and friends instead of confirmed utilizing mental health services. So it is our tradition na baya jud nila. So instead of seeking help sa mga mental health services, we tend to rely on our loved ones or the people around us. It is the tradition of the Filipino mostly. So next one, we have the political lens. Military and authorities' preparedness could reduce military and civilian casualties in operations. So government decisions and actions like the initiation of peace talks matters in solving conflict. So I will give you an example. During the Marawi siege, there was a study that stated that the preparedness or the preparation of the government wasn't enough. That led to a very big casualties in operations. So, importante gud ang mga government preparations or decisions in solving this kind of problems. So, the next one, we have the economic lens. Economically speaking, terrorist operations and state military countermeasures have inflicted not only economic high social cost, life cost, damage to property, business opportunity losses, negative travel advisories, and deepening religious and ethnic tensions between Christians and Muslim Filipinos. So, tungod sa mga war or sa mga terrorism na mga hitabo, it greatly affects our economy, no? Not only ang mga property, ang mga business, but also kanang mga other na mga businesses dire sa community, like kanang mga travel advisories, na mga lack of operations, na mga stop na mga operations due to terrorism. So next one, the poverty has prevented affected people from getting the healthcare they want or the services they need. In short, a lot of affected people are too poor to go to the hospital and get the treatment they actually need. So, economically speaking, poverty also contributes sa mga people negatively contribute sa in seeking mental health. Syempre, pag poor ka, you lack enough fund para mag-seek of mental health. So, next one, we have the many health facilities were in poor condition after the conflict. Yes, due to sa mga due sa tourism or mga gira-gira, our facilities or mental health care facilities has been destroyed or distracted because they were either directly hit by the crossfire or the facilities became temporary housing for displaced families. So there are instances na ang mga healthcare facilities instead na primarily aims to treat people with mental illnesses, nahimo na siya evacuation centers due po sa lack of kanang kapuyanan sa mga tao o grabe ka daghan na nila, diba? So ito, the next one, we have the cultural lens. So culturally speaking, responses to emotional problems in cultures that stigmatize the mentally ill will be very different from those in cultures that high value professional treatment for these problems. So culturally speaking, lahi ra gyud tong mga tao na culturally oriented gani sila o katong mga professionally oriented na mga tao. Katong mga culturally oriented na mga tao, mga family oriented na mga tao, they are more likely to seek or deny the government services that are given to them. They usually they rely to others, they rely mostly sa ilang mga friends, they rely mostly sa ilang mga rituals, sa ilang mga beliefs, sa ilang mga Ginoo. And yun pa dito akong last na ko yun sa symbolic interactionism. It stated that some of them believe that the illnesses or the mental illnesses they suffer is only a test or accursed by their God or their Allah. So moving on, before seeking professional help, Filipino older adults tend to manage their illness by self-monitoring of symptoms. So kani very common siya sa mga Filipino na instead of maadto na ka sa mga healthcare facilities, mental healthcare facilities for check-up, mukuan sa ka murag there is a primary actions for this illness na di magulat pa ka na mas mulala adisir ka mo ato dito sa mga healthcare facilities. So ascertaining possible causes, determining the severity and threat to functional capacity, and considering the financial and emotional burden to the family. So isa pud ka rason nila ani nga di sila mo directly go to healthcare facilities. This is their financial capabilities. Pag gamay ra ang kwarta, so di dayon maato dito syempre, di ba? But which is wrong actually, na mas importante ba ang health over our financial. So we have next one, the spiritual lens. In Filipino culture, mental illness is attributed to superstitious or supernatural causes such as God's will, witchcraft, and sorcery. So naiuban na they believe that kanang mga mental illnesses kay nahimog na ang mga tao na nagsuffer is nahimog nagango-ango kay tungod kay gipang barang they have that belief or gipang tunglo sila, which contradicta psychosocial model used by mental care professionals. So ma-neglect na gud ang mga gipangtun-an sa mga mental care professionals tungod ana ng mga belief in some instances. So another one, we have discrimination to different beliefs and religion. Example, Muslim with mental illness may interpret mental health symptoms as a curse or punishment from God and may regard seeking psychiatric services as showing spiritual weakness. Okay, next one, we have the environmental. Environmentally speaking, environmental pressures contribute to mental stresses like polluted air due to bombing and destruction of establishments, polluted water, and unpleasant surrounding, etc. So, diba, during war or after the aftermath of war, usually ang mga surrounding nato is very unpleasant. Yung mga gubaan ng mga infrastructures, ang mga tubig is kanang dili tarong, walay water, walay enough source of water, hugaw pa jud, di ba nga ang air is polluted due to kanang sa mga smoke bombs, mga aso-aso. So that factors contribute sa mga mental capabilities nato na contribute mo lead ninto siya to mental disorders such as depression. Maka-add up yun siya. So, next one, we have the gender. Women use natural resources and their needs are different for men. So, in ani, we all know that women and men, sometimes we have different needs. Baya ang women mostly is, they're very sensitive. So, they need environment or mga resources na sila lang ang makagamit. So, mahimo sila na vulnerable or most affected na kuan kay tungod kay they have different needs ba you like si botang ta napkins like that. So, women needs that niya. Usually ba kay dili na kuan, murag dili ma-generalize gani. And the other one is young girls adopt traits and behaviors of men for survivability. So, syempre, due to kanang sa mga tragic events, mga traumas, most girls, most children adopt the traits of men or the boys in order for them to survive. So, next one, we have the programs and services. We have first the International Committee of the Red Cross or ICRC. This is a program, an impartial, neutral, and independent, an organization rather, whose humanitarian mission is to protect the lives and dignity of people affected by armed conflicts and to provide them with assistance. We have the Mindanao Trust Fund. Mindanao Trust Fund enables development agencies to pool resources and coordinate support for conflict-affected areas in Mindanao. The MTF is administered by the World Bank, which contributed $1.5 million out of a total of 28.88 million US dollars. So, kaning koan, MTF, this is administered by the World Bank and they have budgeted about 1.5 million. So, ang kaning World Bank, nagatabang po ni sila mostly sa kanang mga conflict-affected areas. So, kanina gibahin na sila 1.5 and others, ginabahinan po na in order for other countries to survive ug makalingkawas sa mga trahedya due to conflicts. Next one, we have the Advanced Psychological Care Support or the APCS program. It is divided into 3 parts. Number 1 is the training sessions that will enhance the skills and knowledge of mental health professionals. So this is more likely focused on kanang for development na yung mga training sa mga professionals so that in return mag-use sila for helping those who needs mental care services. Next one, we have the supervision sessions and on-the-job coaching led by the ICRC. Next, the advocacy for the creation of a mental health program at the institutional level. Example given is in hospitals. So, next one, we have the Philippine Mental Health Association Incorporation. So, it is a private, non-stock, non-profit organization that aims to promote mental health and well-being and prevent and treat mental disorders through education and advocacy and through clinical and intervention services. Lastly, we have the Lusog Isip app of DOH. This is an app made by DOH. It is an app that provides access to self-help and self-care resources to address mental health and substance abuse needs by inviting users to assess their well-being and their coping strategies.